Hello, my name is Dr. Fred Saad, Professor and Chairman of Surgery and Director of Genitourinary Oncology at the University of Montreal. I am here to talk to you today about metastatic hormone-sensitive prostate cancer. Prostate cancer is defined as the uncontrolled growth of cells in the prostate gland and is the second most diagnosed cancer in men. Some people hear the words prostate cancer and think it's one disease, but really it's a spectrum of disease from the early stages where it's localized to the prostate and may not even need treatment, all the way to metastatic castration-resistant prostate cancer, where patients have disease that has progressed and has stopped responding to hormonal or androgen deprivation therapy. In the spectrum of prostate cancer, metastatic hormone-sensitive disease is one of the most important stages where the cancer has unfortunately spread to other organs in the body, most often the bones or the lymph nodes. At this stage, the disease is incurable but will usually respond for some time to hormone therapy, such as androgen deprivation therapy. Our goal is to make this advanced stage of disease a chronic livable disease where patients can maintain their daily living for a long period of time before becoming resistant to the treatment. There is a perception that men don't die with prostate cancer, but once the disease becomes metastatic, almost every patient will eventually die of the disease. In an ideal world, we'd like to cure patients with metastatic prostate cancer, but until this can be achieved, we need to continue to focus on developing effective treatments that extend overall survival and delay disease progression to metastatic castration-resistant prostate cancer, a condition with limited long-term survival, in addition to maintaining daily living for patients for as long as possible. Looking forward, we need to ensure that patients are diagnosed early and put on the right treatment regimen for them from the start. When you tell a patient they've got a metastatic disease, the first thing they think about is that they are going to die quickly. But with advances in prostate cancer treatment, most patients can now hope to live for approximately another 3 to 5 years following a diagnosis of mHSPC. The patient is central to all of this. Deciding on the right treatment regimen right from the start is extremely important. From my experience, the patients who tend to do the best are the ones who understand their disease and are actively involved in the treatment decision-making process. Every person has their own priorities when it comes to their treatment plan. I see some men whose only concern is maintaining their daily living, whereas other patients may want to maintain their daily living but also want to live as long as possible. And so, this is the first part of the discussion, and it's good to have choices. When we talk about metastatic disease, it can be spread to just a few lymph nodes, or it can be in multiple bones and visceral organs. There's a spectrum, and it is essential that we help our patients understand their specific prognosis so they can make an informed decision about the best treatment choice for them. In patients with advanced disease that have a poor prognosis, adding chemotherapy is an effective treatment option, but will involve more adverse events. We therefore have to weigh the side effects of treatment against the benefits and the impact the cancer would have on the patient if treated less aggressively. One thing we want to avoid is having patients stop treatment too early due to side effects. If a patient stops treatment early or has a dose reduction due to adverse events, they may not experience the full benefit of that treatment. It is therefore essential that adverse events of treatments are considered ahead of starting any therapy so that patients are aware and expectations are realistic. By choosing the most appropriate treatment based on shared decision-making, patients are more likely to tolerate and remain on treatment in the long term. Thank you for listening.